Top 25 Public Health Interview Questions and Answers. Hey everyone, welcome back to our channel, where we help you master your professional interviews and land your dream job. If you're preparing for a public health interview, today's video is going to be a game changer. We'll go through the top 25 public health interview questions and answers that hiring managers love to ask. Whether you're applying for a role in epidemiology, health education, or policy development, these questions will help you respond with confidence and clarity. 1. Tell us about yourself. This is usually the opening question in most interviews. Focus on your education, experience, and passion for public health. Example: I have a master's in public health with a concentration in epidemiology. Over the past 5 years, I've worked on community health initiatives focusing on chronic disease prevention. I'm passionate about improving health equity and designing data-driven interventions. My background combines both research and practical fieldwork, allowing me to see how evidence-based strategies can make real-world impacts. Keep your answer concise, confident, and relevant to the role. 2. What motivated you to pursue a career in public health? Employers want to see your genuine passion. You could say, my motivation comes from seeing preventable diseases affecting underserved communities. During my undergraduate studies, I volunteered in rural health campaigns, which opened my eyes to how social determinants influence health outcomes. That experience inspired me to pursue a master's in public health and focus on preventive care and education. I believe that improving access to healthcare and promoting awareness can create lasting community impact. Always connect your motivation to the organization's mission. 3. How do you define public health? A good answer should show understanding of the field's scope. Example: public health is the science and art of preventing disease, prolonging life, and promoting health through organized community efforts. It goes beyond individual treatment, focusing on the health of populations through education, policymaking, and preventive measures. Public health integrates disciplines such as epidemiology, biostatistics, environmental health, and health policy to create sustainable and equitable health outcomes for all. This shows both knowledge and an appreciation of its multidisciplinary nature. 4. What do you know about our organization? Interviewers assess your research and interest. Example: I know your organization is a leader in community-based health programs, particularly your recent initiative addressing mental health among youth. Your focus on data-driven solutions and collaboration with local governments aligns with my experience in evidence-based policy development. I admire your commitment to health equity and inclusion. I believe my background in program evaluation would help advance your mission of improving community wellness. Research their projects and mention specifics to stand out. 5. Describe a successful public health project you worked on. Use the STAR method: situation, task, action, result. Example: in my previous role, I led a vaccination awareness campaign targeting low-income neighborhoods. We partnered with local schools and clinics to host informational sessions. As a result, vaccination rates increased by 30% in 6 months. This project taught me the power of community engagement and culturally sensitive communication in driving behavioral change. Highlight measurable outcomes, teamwork, and community involvement. 6. How do you handle data analysis in public health research? Employers want analytical skills. You might say, I use statistical tools such as SPSS, R, and Excel to analyze survey and epidemiological data. I start by cleaning and organizing datasets, then perform descriptive and inferential analyses to identify trends and correlations. I also focus on visualizing data clearly for non-technical audiences. In my last project, my analysis helped identify key risk factors for hypertension in urban communities, which informed intervention strategies. Mention tools and insights gained. 7. How do you deal with public resistance during health campaigns? This tests communication and empathy. Example: resistance often arises from mistrust or misinformation. I address it by engaging community leaders, listening to concerns, and providing transparent, evidence-based information. In one campaign, we faced vaccine hesitancy, so I organized town hall meetings with healthcare professionals to build trust. Over time, participation improved significantly. Understanding cultural perspectives and building relationships is key to changing health behaviors. 8. What is your experience with health policy development? Example: in my previous role, I worked on drafting local health ordinances for tobacco control. My responsibilities included conducting policy reviews, analyzing public health data, and preparing policy briefs for stakeholders. I collaborated with policymakers to ensure the proposals were both effective and feasible. The resulting policy reduced smoking rates among adolescents by 15%. I enjoy the challenge of translating research into practical policies that improve population health. 9. How do you ensure cultural competency in your work? Example: cultural competence starts with awareness and respect. I always consider the community's language, values, and traditions when designing programs. For instance, during a maternal health project, we partnered with community elders and used local dialects for communication. This approach increased participation and trust. I also continuously educate myself through training and community engagement to avoid assumptions and ensure inclusivity in all initiatives. 10. What are the major challenges in public health today? Example. Some major challenges include misinformation, health disparities, climate change, and emerging infectious diseases. Misinformation, especially online, can undermine vaccination efforts and public trust. Health inequities persist across socioeconomic and racial lines, demanding systemic change. Additionally, climate change is influencing disease patterns. Addressing these requires multidisciplinary collaboration, effective communication, and strong policy advocacy. 11. How do you prioritize tasks when managing multiple projects? Example. In public health, juggling multiple initiatives is common. I prioritize tasks by assessing urgency, impact, and deadlines. I use project management tools like Trello and Gantt charts to stay organized. I also communicate proactively with my team to delegate tasks and ensure alignment. For instance, when managing a vaccination program and a nutrition campaign simultaneously, I created a weekly progress tracker to monitor milestones. This system kept both projects on schedule while maintaining quality outcomes. 12. Describe your experience with community engagement. Example. Community engagement is at the heart of effective public health work. I've led multiple workshops and focus groups to understand local health challenges. During one diabetes prevention project, I collaborated with community leaders to design culturally tailored materials. We trained peer educators who helped increase participation rates by 40%. Engaging directly with communities builds trust, ensures program relevance, and empowers people to take ownership of their health outcomes. 13. How do you handle ethical dilemmas in public health? Example. Public health often faces ethical dilemmas involving privacy, resource allocation, or community consent. My approach is to adhere to established ethical frameworks and involve all relevant stakeholders. For instance, during a data sharing project, I ensured that participants' information was anonymized and obtained informed consent. I also consulted with our ethics committee to maintain transparency. Balancing public good with individual rights is essential for maintaining trust and integrity in the field. 14. What is your experience with outbreak investigation? Example. I've participated in several outbreak investigations, particularly related to foodborne illnesses. My role included case interviews, data collection, and identifying exposure sources. Using epidemiological tools like case control studies, we pinpointed a contaminated food supplier. I then worked with local health authorities to implement control measures, preventing further infections. This experience strengthened my ability to analyze data quickly, collaborate with multidisciplinary teams, and communicate findings under pressure. 15. How do you stay updated on public health trends and research? Example. I stay current by subscribing to publications like the CDC's Morbidity and Mortality Weekly Report and the Lancet Public Health. I also attend webinars and professional conferences to learn from experts and peers. Additionally, I'm part of online communities and LinkedIn groups where professionals discuss the latest policies and case studies. Continuous learning helps me apply evidence-based practices in my work and anticipate emerging health challenges. 16. What role does technology play in public health? Example. Technology revolutionizes how we collect, analyze, and communicate health data. Digital tools enable real-time disease tracking, telehealth services, and health education campaigns through social media. For example, I've used GIS mapping to visualize disease hotspots and optimize resource distribution. I also advocate for using mobile health apps to monitor chronic diseases. Embracing technology enhances efficiency and accessibility in delivering public health services. 17. How do you measure the success of a public health program? Example. Program success is measured through predefined indicators like participation rates, behavior changes, and health outcomes. I use both qualitative and quantitative methods, such as pre- and post-surveys, focus groups, and statistical analysis, to assess effectiveness. In a recent nutrition campaign, BMI reduction and increased fruit intake were key metrics. We also gathered community feedback to gauge satisfaction. Measuring both outcomes and impact ensures continuous improvement. 18. Describe a time when you had to work with limited resources. Example. During a rural health education project, our funding was cut midway. Instead of halting operations, I restructured the program by prioritizing essential activities and engaging volunteers. We leveraged partnerships with local NGOs for materials. Despite budget constraints, we completed the campaign and reached 80% of the target population. This taught me resourcefulness, adaptability, and the value of collaboration when facing challenges. 19. How do you communicate complex data to non-technical audiences? Example. Effective communication is crucial in public health. I simplify data by using visuals like charts and infographics and avoiding technical jargon. In a report on air pollution, I translated scientific terms into relatable examples, like comparing PM 2.5 exposure to cigarette consumption. This helped local officials and residents understand the issue's urgency and act accordingly. Making data accessible fosters informed decision-making and community engagement. 20. How do you handle conflict within a public health team? Example. Conflicts often stem from miscommunication or differing priorities. I address them by encouraging open dialogue and focusing on shared goals. In one project, disagreements arose over data interpretation. I organized a meeting where everyone presented their perspective backed by evidence. This collaborative discussion led to a consensus-driven approach. Maintaining respect and empathy ensures productive teamwork and better outcomes. 21. What are your views on preventive healthcare? Example. Preventive healthcare is the cornerstone of public health. It reduces disease burden, healthcare costs, and improves quality of life. I believe prevention starts with education and community empowerment. For instance, vaccination, nutrition awareness, and regular screenings are vital. In my work, I emphasize early intervention and health literacy because small preventive steps lead to long-term health gains for entire populations. 22. How do you approach health equity in your work? Example. Health equity means ensuring everyone has a fair opportunity to attain their highest health potential. I actively identify and address barriers like income, education, and access disparities. In a recent community health project, we provided free screenings in underserved areas and partnered with local organizations to improve accessibility. Prioritizing equity ensures that interventions benefit those most in need, fostering inclusive and sustainable health improvements. 23. What steps would you take during a public health emergency? Example. During an emergency like a disease outbreak, my priorities are rapid assessment, communication, and coordination. I would first collect accurate data to understand the scope, then establish communication channels for information dissemination. Collaborating with local health authorities and stakeholders ensures swift response and containment. I'd also ensure transparency to build public trust and compliance. Clear protocols and teamwork are essential in crisis management. 24. How do you collaborate with other sectors in public health? Example. Public health is inherently interdisciplinary. I've worked with education departments, NGOs, and local governments to integrate health initiatives into broader development plans. For instance, we partnered with schools to include hygiene education in the curriculum. Collaboration maximizes impact by addressing health issues from multiple angles, such as environment, economy, and education. Effective intersectoral cooperation leads to holistic, sustainable health improvements. 25. Where do you see yourself in 5 years? Example. In 5 years, I envision myself taking on a leadership role in program development or health policy advocacy. I aim to contribute to national-level health initiatives focusing on prevention and equity. I also plan to pursue further specialization in data-driven public health interventions. My goal is to continue learning and leading efforts that create measurable, positive impacts on community health. And that wraps up our list of the top 25 public health interview questions and answers. Remember, preparation and authenticity are your best tools in any interview. Practice these answers, adapt them to your own experience, and walk into that interview with confidence. If you found this video helpful, don't forget to like, subscribe, and share it with your fellow public health professionals. Thanks for watching, and good luck on your interview journey.